All right, good evening, everyone, and welcome to the program Your Health 360, only on Invicta 98.9 FM, Kaduna, to the world. My name is Jacqueline Adebija, and I'm particularly excited this evening for several reasons. Now, the doctor that we have with us in the house is not a doctor that you get often. I mean, you send her messages, you talk to her, and she hardly has the time to come in. But when they have goodies for the people, it's a double celebration for me, particularly in the field in which this doctor finds herself. The moment a man and a woman get married, the next thing you start to hear from people, family, friends, and enemies alike, like someone loves to say, is, so when are we coming to eat rice? When is that baby coming, or when are the babies coming? There's hardly any prayer that is said over a marriage that does not begin to allude to the fruitfulness of that home. So you can imagine the enormous pressure that is on any one couple that gets married at any one time. They go into that marriage fully expecting that things are just going to be natural. It's just going to be wham, bam, thank you, ma'am. The next thing is rice and many drinks flowing. And so what happens when those expectations are not met as thought? That is why it is with pleasure I welcome Dr. Selma Pam this evening. She is a gynecologist, she's an obstetrician, and she has specialty in the area of fertility. And that's why I'm so happy to have her here. And then to add icing to cake. I mean, I love bringing things like this up for our listeners, because otherwise you wouldn't know. There's goodies coming from Dr. Selma, but I'm not going to let the cat out of the bag just yet. Let's welcome her first. Let's say, Dr. Selma, you're welcome. It's great to have you here.
Thank you very much, Jackie. It's always a pleasure to be on your show.
It's a pleasure, but you hardly come. No time, no time, no time. Well, Dr. Selma, before we move into the goodies that a lot of Kadunans, and I dare say even people outside Kaduna, are likely to have the privilege of accessing those services and at beaten down prices, almost to nothing. I would like for us to talk about fertility, what it is. How do you classify, when do you medically say a couple is infertile? What exactly is the definition of fertility? And then, of course, at what point should a couple start to seek for outside help?
Okay, so infertility has a basic definition. When you have a couple that are living together, they're having regular unprotected intercourse for a year, and they are unable to achieve a pregnancy, you can say that couple is infertile. Now, if you have 100 young couples, and when I say young, I mean the lady is less than 35 years old. So if you are following up 100 young couples for 1 year and they're having regular intercourse, they're not using any form of protection or family planning, as we like to call it in Nigeria, 85 of those 100 couples will get pregnant in a year. If you follow the remaining people, so that's about 15 people that have not gotten pregnant for a second year, half of those people will get pregnant. So that's why we now define infertility as the inability of a couple to achieve pregnancy after a regular, unprotected intercourse for a year. So you've lived together as a couple for 1 year, you've been trying, you've not had any type of family planning, and you don't get pregnant in a year. It makes sense for you to seek help to find out if there's any problem. Okay? If you come to a reputable hospital or clinic and you seek help and everything looks okay, it's okay to wait for another year to see what happens. But if after 2 years and they can't really find any problem and you're not getting pregnant, then we can now say, oh, this is an infertile couple. But there is a caveat. Remember I said young couples, 85% of them, that's 85 out of 100 will get pregnant in a year. If the lady is 35 years and above, you may want to seek help faster. And the reason is fertility in a woman is time bound. So the moment you are 35 and above, the clock is literally ticking. So there may not be enough time to have any, investigations or treatments that will work. So that's why if a lady is 35 years and above, if she's tried for 3 months, for instance, it makes sense for her to start seeking help in case she may need some assistance.
Okay. Is it just women who face the biological clock ticking?
Sadly, yes. Sadly.
Okay, so then why do we get some men having the morphology of the spermatozoa changing with age? I've heard that, or is that wrong?
Yeah, you mean, as a man grows older, okay, yeah, things slow down a bit. But the truth is that technically, no matter how old a man is, technically, he can make a woman pregnant.
Technically?
Yes, because now for women, your eggs are made in you when you are in your mother's womb. So you can see how old those eggs are. But it's different for the man. So the sperm cycle keeps changing. It keeps renewing itself. Unlike the eggs that the number is set, everything is set. So from the moment you're in your mother's womb, you literally start losing eggs. That's why we say by the time reproductive age is described as the age of 15 years to 45 years. So if you have a child outside those years, is basically a blessing child. People will say, oh, I see a 50-year-old woman getting pregnant. It is an exception. It is not the rule, you understand. But it's different for men. So you can see a 90-year-old man fathering a child. It's not like that for the woman. That is why we now tie the age to the woman's age and say women come in early, especially if you, for whatever reason, maybe you don't get married before the age of 35, or you get married and you don't decide to start having children until that. But once you're 35 and you haven't had children, or even if you've had children and you want more, it's a good age for you to seek help because the clock is literally ticking.
So technically, realistically, how realistic is what you just said for a man? A 90-year-old, the sperm still swims fast?
The sperm still swims. I mean, the issue will now be, can he perform intercourse without any health challenges? That will be the issue. But with something like IVF, for instance, as long as we can get sperm, he can father a child. But you do see 90-year-olds walking about very agile. The only thing is that a lot of 90-year-olds have older wives, so that's probably why they're not having children. But you see older men marrying younger women, and they go ahead and keep having children.
So the procedure behind it is that we have sperm being generated regularly on a daily basis, but eggs come from the womb.
Eggs, so for the woman, the eggs, the number is set. Okay? So when you are born, you have about 400, 500,000 eggs, give or take. And then by the time you get to puberty, you start losing a lot. So, I mean, we've heard of ovulation. What happens at ovulation? A group of eggs, I'm not going to the technicality. A group of eggs is recruited. So imagine you have a marathon, okay? A marathon, you have 1,000 runners at the beginning, but only one person is going to come first.
Right.
So that's how it sort of is like ovulation. So a cohort of eggs is recruited, and everyone is trying, to see which one is going to get mature, which one is going to ovulate, which one is the one that is going to break literally and be available for sperm. So remember, a group is recruited, and only one or sometimes two now end up getting to the point of ovulation. So you lose all those ones, and then next month the cycle comes and you lose. Some people start their period at 10 years. So she starts her period at January and she's 10. So January, she's losing maybe 20 eggs. February, March, April, May. And then she keeps losing them every month because she only has one or two that get to the point of ovulation. And this continues until she gets married at 18, 19, 20, or even 35. So by the time she's 35, these are eggs that have been in her since she was in her mother's womb. So they're old, so to speak. So it now makes sense why the older you are, the ovulation process is not as efficient. And then you have older eggs. That's why older women tend to have more abnormal babies. You see people say, oh, if you're going to have a baby after 40, you'll give birth to a Down syndrome baby and all that. The reason is more of the eggs that are left are old. So the chances are you're more likely to have an abnormal baby. Do you understand? So that's why the push is, if you're going to do something about it, do it early.
So this is why we have people freezing, because I was going to ask you that. If that is the case, I mean, like, why then the hurry if you're still menstruating? But you explained it when you said the eggs actually have aged.
Yes.
Because they've been there right from the mother's womb.
Yes.
So now I understand why some women harvest those eggs and they have them frozen. But, you know, another thing I'm just learning right now, and you might care to expatiate on it, is that when those eggs are recruited during every menstrual cycle, my thinking was the one that ripens and is released for sperm or not, depending, the rest actually go back and wait on the line.
No, they don't. So they become atretic. So they die off literally. And a new cohort is recruited the next month, and then it continues like that and like that. So that's what happens here. Then you see, there's something we call premature ovarian aging. So usually, you know, you start getting the signals for aging maybe around 35 and all that. But for some people, it comes early. So you have a woman that is 40, for instance, less than 40, and her ovary is already at the age of menopause. So that happens to some people. She may still be having periods, but when you do her blood tests, the hormonal levels are the levels of someone that has attained menopause. So there's also that phenomenon.
Are there factors responsible for this?
Sometimes it's familial, you know. You just can't pinpoint what is making her ovary age. For some people, they've had some surgery done to the ovary. For example, you have a cyst removed. Now, in the process of having a cyst removed, there can be some damage to the ovary. For instance, maybe the blood supplying the ovary is compromised. So that ovary sort of dies off. It's not working as well. That ovary now is like a menopausal ovary. You know, so these are things that happen. That's why when you see a cyst, an ovarian cyst, you don't just rush to go and take it out. There are certain criteria you look at before you take out a cyst, especially in a young woman who has not had children yet and who plans to have children. You talked about egg freezing. Egg freezing is done when you know you really want to have children and you're not ready for whatever reason. Maybe perhaps you don't have the right partner. It's also done for people that are going to have potentially damaging surgery or treatment. So if you're going to have cancer treatment, for instance, let's say radiotherapy, where your abdominal cavity, the rays are going to be passed there, it makes sense to have an IVF cycle to recruit those eggs and then store them. Because after you have that cancer treatment, those ovaries may die off. You know, so these are things that people do. So it's not just for fashionable reasons, for instance, that people freeze their eggs. Some people, it's a real need and they don't know. And same for men too. You're going to have some surgery or some treatment that can potentially damage testes. You can have sperm frozen, you know, and that can last for, I think the oldest I've heard is a woman has used eggs that have been frozen for 20 years and she achieved the pregnancy with those eggs. So it can last for, at least we're sure of 20 years, maybe more.
Do we have those facilities?
Yeah, we do. In NISA, we do. As we speak, we have frozen eggs, we have frozen sperm, we have frozen embryo. Embryo is when the egg and the sperm are fertilized. So at NISA Kaduna here, we offer all those services.
Fantastic. Fantastic. And, you know, with this explanation from Dr. Selma, one begins to get an idea why we shouldn't take willful abortion so flippantly. I mean, like, there are people who will boast that every month, you know, I go for a D&C, I have, you know, I get pregnant and I don't want the baby and I just have it removed. And with this explanation, it makes you see it in a different light, right? When you know that there's actually, to every woman, a certain number of eggs.
You see, the thing with the abortion, and coming from not even a religious point of view now, even from a health point of view, for you to be getting pregnant all the time, that means you're having unprotected sex. Okay? So why are you having sex and not using any form of protection? And when I talk about protection, I'm talking about condoms. Because as a woman, you are exposing yourself to all sorts of diseases. Now, one of the commonest causes of female infertility is blocked tubes. And one of the commonest causes of blocked tubes is infections. And a lot of those infections are ascending. That is, it is coming in from the vagina and climbing all the way up to your tubes and blocking them. So when you see an unwanted pregnancy, what I hear is she is not using condoms. If you are sure that you don't want children, there are many ways to prevent children. I mean, first of all, and my own favorite method is abstinence. But if you, for whatever reason, cannot comply to abstinence, then you must use condoms, even if you are using some sort of protection. You know, you have pills, you have all sorts of things that you use. But this constant having terminations is not even good for the body. And then the thing is that if you are unlucky to fall into the hands of someone, or for instance, you allow the pregnancy go a little far, and then it now has to be a surgical termination where instruments have to be used to literally scrape out the fetus. You can scrape off the lining of your womb. And for us in infertility, the lining of your womb is like gold. Because if you don't have it's called the endometrium. If you don't have an endometrial layer, there is no way you're going to achieve pregnancy in that womb. That's where the issue of a surrogate pregnancy now comes up. Someone now has to carry your pregnancy for you. So this having repeated abortions is not good for the cycle. It's not good for the womb. It's not even good for your mental state. So for many reasons, I mean, HIV is always there, but there are other infections too. So my own advice is, number one, abstain. Abstain if you know you don't want children. And if you cannot abstain, then use a reliable form of contraception and also use condoms. So that's what we call dual protection.
Wow. Okay, so that's another a nugget of wisdom for anyone listening out there. I mean, today it looks all fun and games. It's all fun and games, like we love to say, until you get married and you want that baby. And then you find out that in all the numerous scrapings that have happened in the past, like Doc said, the lining is gone. She called it their own technical name, endometrium. But for me, I mean, the lining is gone, the lining is gone. And I'm just learning too, just now, doctor, that lining is not rebuildable. You cannot culture it, you cannot replace it, you cannot do anything. If it's scraped, it's scraped.
It is. Sometimes there are some women that is not completely scraped off. So that's when you now hear people say they have things like Asherman syndrome, or you hear they say, oh, I have adhesions in my womb. But it's notoriously very difficult to regenerate the endometrium. Some people are lucky. Let's say it's just a portion that is damaged. And then the portion that is not damaged can be regenerated. But it's an arduous process. So you keep going in there, and then the adhesion, so it's like it's gummed together. So you sort of cut off all the gummed parts and try to keep them apart and see if they will grow. But it's unnecessary.
Right.
It's unnecessary.
Well, let's come to the sweet part, the part that I'm so excited about. I mean, to hear that NISA Fertility Clinic is having an open day where people, I mean, like, talk to us. What do you have prepared for our listeners and our listeners, friends, and family? Because I know this news will go far. So what exactly can we expect from NISA? On what days? Where are you even located?
So tomorrow, Saturday the 26th of March, we have what we call an open day. So an open day is the day we open up our doors to everybody. You come in, it's free. So you interact with all the staff. You interact with the nurses, with the doctors, with the embryologists. We talk about fertility. We talk about infertility. We are open to answer your questions. We even give very short consultations, because usually there are lots of people. So, free consultations are hard. You have an idea of what you need to do. And why this particular open day is really exciting for us is that we've tied it to the discounted services that are ongoing. So, I mean, you don't need anybody to tell you that things are really rough in Nigeria financially now.
True.
So what we've decided to do in NISA Kaduna is to really discount our services, and it's a lovely package.
Fantastic.
So I would advise people, come in tomorrow, okay, and hear for yourself what the package entails, how you can access these services, and then let's see, it's going to run for the next 2 months.
Oh,
so it's worthwhile.
wow.
Yeah, worthwhile coming in.
Because when I heard that a place like yours, I mean, Nisa Fertility Clinic is center is renowned. I mean, it's in Abuja, it's in Kaduna, so many places. So when I heard that you were going to have an open day and you had decided to slash your prices, for me, it was a no-brainer that, I mean, you had to come here and let the people of Kaduna know. Because I know, I mean, I also have the privilege of hearing stories because of another program that I handle, how infertility has impacted on homes.
Yeah.
And it's not funny because many times women need these services, but especially for economic reasons, are unable to access it. So we're talking about people getting your attention tomorrow for free, at least, even if you said, yeah, a lot of people will be there, but you will at least listen to people and probably be able to point them in the right direction.
Yes,
Hearing from
particularly
them.
young people, because what our experience has shown is that lots of people come in to access our services when they're older. Remember what we said about the woman's age, and when they can't really benefit. So my special shout out is to the young couples who are really keen on having a baby, who have not been able to achieve a pregnancy. Come in and see, because this is the best time to have the intervention, and then it is cost friendly now. Hopefully it will last. This will go on for the next 2 months, but just come in and be enlightened, because there's a lot of wrong information going out there. Our services include IVF. We found out that people know little to nothing about IVF. There's so many misconceptions.
Apart from the abbreviation IVF.
Someone even came in and said, "Oh, if I get pregnant with IVF, am I the one carrying the pregnancy, or will you put the pregnancy in a bottle?" I said, "No." All we do in IVF just means in vitro fertilization. That means that fertilization that normally takes place in the woman's tubes is now going to take place in the lab. So you will give us your eggs and you will give us your sperm. We do the fertilization and then we put it back in your womb and we pray for the best. Because the truth is, IVF doesn't always work. So you have roughly a 4/10 chance of you working, but more so in the young people. And that's why my shout out is to young people. Come in now when you are young. Come in now when it's more likely to work, and you try it once and it works. Some people have to do IVF 10 times before it works. Some people don't even need IVF. So that's why we have this open day. What are your problems? What do you need? Some people may just need counseling. Some people may need tablets. Some people may need surgical interventions, and some people may need IVF. And some people may need to understand that their best bet of having children is to have an adoption. So whatever it is, we're there for you to listen to you, answer your questions, and guide you. That's tomorrow. It starts at about 11:30 a.m. at 58 Yakubu Avenue, Angwarimi GRA. It's on the road of Bafra Hotel.
Right.
Yeah.
Okay. So what can a woman just walk in, or would you rather see her and her husband?
It's a couple thing. And you see, I've talked so much about the woman and her age, which is not complete, because a lot of the times it is male infertility. So men have issues too. Yes, men produce sperm until literally they die, but men have issues. We have some men that, number one, they are born not producing sperm. For instance, when they were in their mother's womb, something may have gone wrong in the process of development. Okay, some people have had infections when they were younger, especially during their adventurous ages, that have now blocked the route for the sperm to come out. So they are producing sperm, but it doesn't come out. Now, you need to understand that sperm and seminal fluid are two different things. So when a man ejaculates, that substance you see is seminal fluid. Within the seminal fluid, there are sperms. So sperms are the active cells. It can only be seen under the microscope. So the fact that you ejaculate and you see the creamy substance, for instance, coming out, it doesn't mean that you are producing sperm.
What if the consistency is thick?
It still doesn't matter, thick, thin, whatever. Until you put it under a microscope and see sperm cells, then you're sure that that seminal fluid contains sperm. So number one, some men are born with the inability to produce sperm. Some men produce sperm, but something along the line has blocked the roots, usually infection or sometimes even surgical manipulations. And then some men have some conditions that just block the production of sperm at some stage. So it's not always women that have the problem. Sometimes it is the men. So that's why the initial consultation, ideally, it should be the couple. So you come in, we counsel you, investigate, examine, do all the tests, get a sperm sample, do a scan, do some x-rays, and then we can now pinpoint where the problem is coming from. And we can advise. This is what we advise you to do. And one thing people have to realize, when you come into a fertility clinic, remember you are coming in to find out what the problem is and what the solution is. Sometimes the solution may not be acceptable to you, but at least you know. But for you to sit down and not know what the problem is, it may be a simple solution. So that's why tomorrow open day really makes sense. Just come in and hear, oh, this is probably my problem. Okay, I'm advised to do IVF. Oh, IVF is not acceptable to me. At least now I know. Or IVF is acceptable to me. I'll go on. Or I need tablets. Or I need to lose weight. Or, it's different things for different people. But it makes sense to try. Especially if you're sure you want to have children, because that's another thing. Sometimes people don't want to have children, but people put pressure on them. You've been married for so long. Why are you not having children? The truth is that they may not want to. So if you know you really want to, it's something you really desire, then, and it's not happening, it's the longest I would say a couple should wait is 2 years. After 2 years, if there's no child, you need to seek help in a proper place. And can I just say, for men, before you have any surgical manipulation, I will advise you to see if you are eligible for IVF, because sometimes some of these surgical manipulations end up causing more harm than good. So a man in which we will have been able to get sperm to do IVF now goes and has some surgery done, then everything, production stops. We can't even get the sperm again. So my honest advice, before you do surgery as a man, consider doing IVF and then do the surgery, or consider freezing your sperms, for instance, so that if anything goes wrong with the surgery, you know that, I have some sperm stored in so clinic. I can always fall back on, because that's another challenge that we have. And if a man is going to have any surgery, I urge you, make sure it is done in a teaching hospital, where you are sure you are seeing a urologist who is using the best available recent knowledge to treat you. Because, sorry to say, and apologies to my colleagues, a lot of wrong things are going on out there. And once the damage is done, the damage is done. You cannot create an egg, you cannot create a sperm. So if you have been blocked from producing your own due to a error on our parts, on part of medical practitioners, even if the error is done in good faith, it's gone, it's gone.
I'd like to open up the phone lines quickly this evening. Of course, we're live on Facebook. Please drop your comments and questions there for Dr. Selma Pam this evening, a gynecologist and obstetrician with specialty in fertility treatment. She's here with us in Kaduna at the NISA Fertility clinic or center, I would say. And of course, just the best way to describe this, because we're here for our listeners, would be if you know where Bafra Hotel is, they're along that line, not too far from the UNICEF office too. So I know a lot of people know where I'm talking about, not too far from the Essence International School Junction. You would branch off and then be able to get to that place. But before then, we're here now, so I'd love to open up the phone lines, and I'll be looking out for your questions on Facebook. And the numbers are 081 40,000 989. Once again, that's 081 40,000 989 and 070 87800 989. Once again, that's 070 87800 989. You don't need to introduce yourself. Just go straight to your question. Hello, good evening.
Good evening.
Good evening.
Yes, engineer.
Hello?
Hello?
Yes, we can hear you now.
It's Engineer Muhammad Falalu. I'm calling from Kaduna.
Engineer, you're welcome. Go ahead.
Yeah, please, I want the doctor to explain to me what is the difference between IBS and surrogacy.
IVF and surrogacy.
Yes,
All
I'm
right.
surrogate.
Okay.
Yes.
All right, engineer. Thank you very much. Hello, good evening.
Hello, good evening.
Yes, you're welcome. Go ahead with your question.
Thank you. Please, I'm married. Well, with 3 kids.
You're too close to your radio set, so we're hearing you, but we are hearing an echo, so it's not nice.
Okay, are you understanding me now?
Yes, this is better. Go ahead, please. Hello? Oh, that line got cut off. Please try to get us back. Hello, good evening.
Hello, good evening, Jacqueline.
Yes, you're welcome, sir.
Yes, Gabriel.
You're welcome.
I have one problem. I have a daughter that, in fact, about 5 years ago, she implemented, she put part on the child, she lost the child. But since then, nothing has come her way as a pregnancy. And she always, from the way I look at her, when I go to the hospital, I see that she's getting fatter and fatter. So I don't know actually. So with the advice of the doctor, I think maybe
is your daughter in Kaduna?
Come and see.
Yes.
Yes.
She needs to
come and see her.
Yes. She needs. I mean, this is. Yes. Go ahead, please.
Hello.
Go ahead, sir.
Yeah. So that's exactly what is my concern.
Okay.
Because by the grace of God, I believe with what Jacqueline is doing and the Invita, and with the direction the doctor is saying, I think I will advise her to come and go and see her.
Very important. Very important.
So we are really grateful for this program, please. May Almighty God bless.
You're welcome, Engineer Gabriel. And that's why we're here. I mean, we need to get this information out there to our faithful listeners. Still taking your calls this evening. 081 40,000 989 and 070 989. With us in the studio, Dr. Selma Pam, and even I have learned a number of things this evening. I mean, the consistency of sperm does not speak to its quality. Hello, good evening.
Hello, good evening.
Yes, you're welcome, sir. Go ahead with your question.
I want the doctor to talk about the religion part to it. You know how religious we are in this country. Maybe I'm sure he understands what I mean. The religious part to this, the coins and the note. And again, for those who may not be able to attend, is there any way they can also benefit as well? Or any social handles or online or anything that one can follow as well in case you will not be able to be present.
Maybe those people are not in Kaduna or something. All right. So let's come back to Dr. Pam quickly and answer those two questions. The first one from Engineer Falelu. What's the difference between IVF and surrogacy? And then the second one from this caller talking about those who are unable. Two things, actually. The religious aspect of all of this that we're doing, assisted fertility. How in tune with our religion is it? And then, of course, are there ways in which people could still be able to see what you're doing tomorrow?
All right. So IVF stands for in vitro fertilization. Okay. The I is in, V, vitro, and then F, fertilization. What that simply means is fertilization outside the body. In vitro means outside the body. So normally, during the course of intercourse, a man puts sperm within a woman, okay, and the sperm meets the egg. Fertilization takes place inside the woman's body, and that fertilized egg, called an embryo now, finds its way to her womb. It settles there, it implants there, and she achieves a pregnancy. That is normal, natural. Now, for IVF, which is an assisted form of reproduction, we get the woman to give us eggs. So we give her medication so that she can produce eggs on demand. We get those eggs out. The man gives us his sperm, okay? And then we now do the fertilization in the lab. And then when that fertilization takes place, that fertilized egg, the embryo, we now return it to the woman's womb, and we watch to see if it will implant and she will achieve a pregnancy. So that is IVF. All right. Now, surrogacy means carrying pregnancy for somebody. So if you do IVF, so you give us your eggs, you give us your sperm, we do the fertilization. If for whatever reason your womb cannot carry a pregnancy, we can put your eggs and sperm that are fertilized into another woman's womb. to carry that pregnancy for you. But that baby is your baby because it is made from your eggs and from your sperm. So that is what surrogacy is. And there are many reasons why a woman's womb can't carry pregnancy. For instance, we may have tried IVF maybe 10 times. It's just not working and she's getting older and we have good embryos, okay? For some people, the womb is damaged, like this lining I told you. Okay, so one of the reasons the lining gets damaged is over-scraping. When people don't do surgical terminations properly. Another common reason now that is coming up now is endometriosis. So you may have heard of endometriosis. Now, when a woman's womb has endometriosis, or it's called adenomyosis, that womb is not receptive, is quite hostile to the embryo. So for such people, sometimes we advise them, why not somebody carry your pregnancy for you? And then some people do it for health reasons. A woman has maybe a bad heart condition. Her body cannot take a pregnancy. Some people are sick. Some people's wombs have been removed because of disease or accident or whatever. And then some people, like these stars we see now, maybe for social reasons. Maybe she doesn't want her body destroyed or whatever. So those are reasons why somebody else will carry a pregnancy for you. But once that baby is born, your baby is given back to you. If you do a DNA test on that baby, it will show that you are the mother, you are the father. So someone just helped you carry the baby. We have instances abroad, for instance, where a mother will carry her own child's baby. So the grandmother is the one carrying the pregnancy for her daughter. There are times like that. You know, some women are born without a womb, but they have ovaries. So for such people, sometimes somebody has to carry a pregnancy for you. So that's the difference between IVF and surrogacy. Now, coming to the religious aspect, if you remember, I said, if you are infertile, when you come to the hospital, you are coming to find out what the reason for your infertility is and find solutions. So solutions are given to you. It is up to you to accept or not to accept. I sit here as a doctor. I am not sitting here as a Christian. I am a Christian, okay? But the seat I'm occupying now is a doctor. So I will tell you, medically speaking, these are your options. IVF, surrogacy, whatever it is. And you now have to accept. The issue of religion, in my opinion, is a personal journey. So there are some churches or there are some religions that say, oh, IVF is not allowed. I cannot now tell you that your religion is wrong or you should go against it or go for it. You have to make that decision, what you want. I cannot tell you this religion is right for accepting IVF or this religion is wrong. All I can tell you is medically, these are your options. Because sometimes we have patients that come and I tell you, oh, you're at menopause, we cannot get eggs from you. They say, God forbid, it's not my portion. I say, yes. I'm speaking not with faith now. I'm speaking facts. I'm speaking medical, scientific facts. But of course, we know that faith has always shown that medicine is different. So when it comes to the religious point of view, you have to decide what is acceptable, what is not acceptable. There are people that we've told that IVF is your option. They say, no, it's not acceptable for me. So I said, now you know. Now you can live out your life without children and you can be at peace. Do you understand? You know that, okay, the only medical option is not acceptable. But sometimes it may not be IVF. Sometimes, as I said, it may just be tablets. In fact, there was a lady we had that had been infertile, you know, she's been married for over 5 years. And she had a few things going on. So we were giving her tablets. Meanwhile, we were working her up for IVF. But guess what? The tablets worked. Because initially she wasn't taking them as we advised her to, but when she started taking them, she started ovulating properly. She conceived. And some people say, oh, we didn't do anything. She gained from coming to us.
True.
So I would just say, first of all, find out what your religion's position is on whatever treatment we offer you. Discuss with your imam or discuss with your pastor or whatever and decide, do you want to take up the treatment or not? After all, we have people like Jehovah's Witnesses. We tell them you need blood. They say no. And they die gallantly without taking blood. I'm not in a position to say they are wrong or they are right. So that's what it comes for the religion. As regards people that cannot come, there are numbers which I guess I'll give at the end of the show. So call and make inquiries. Even if you cannot come for the open day, you can make inquiries. You can now come in and have a counseling session, and then we take it from there.
Okay.
Regards the costs, you know, that's why we've really slashed prices. So you have to come in and find out and see, do you fit in, and what is available, what works for you, what are you being advised to do. Okay.
All right. See why I told you that we love having Dr. Selma with us, but she hardly has our time. So much that she has to give as per information. Let's go on a quick commercial break. And when we get back, Dr. Selma will be reeling out those numbers through which you can get through to her or to someone at the hospital. And I see Honorable Micah, I see your message. And I think the next segment here where she'll be giving you numbers is going to answer your question. Do stay with us. We'll be right back. Well, thank you for staying with us there. Every time we have fun with Dr. Selma in the studio, the time just seems to fly by. But quickly, Dr. Selma, before you call out those contact numbers, I remember one of our callers did ask about the daughter, why putting on weight, she had the baby, lost it, and then just started putting on weight and hasn't conceived yet.
So, many things can happen to prevent a woman from conceiving after having a baby. First of all, what happened during the labor? Or did she labor? Did she have a cesarean section? Was there damage done during the cesarean section? Or during labor, did her placenta come out immediately? Or did it have to be removed manually? Did she have an infection later? Did she bleed for many weeks after delivery? Was there an offensive vaginal discharge? These are things that we need to know. If she's had anything that's giving her an infection, then maybe her tubes are damaged. Do you understand? Sometimes at cesarean section, somebody's womb can be removed, maybe to save their life, and the woman may not understand, or she may not even want to share with her father that actually my womb was removed because they had to save my life. So I can't really say anything. All I'll say is that, she needs to see a doctor and then find out what is happening. As regards putting on weight, many things make us put on weight. Sometimes it's illness, sometimes it's a state of mind, so we can't tell. So her best bet is, see a doctor and take it from there. All these questions have to be asked, examinations done, maybe some tests done, and then we'll get to the bottom of it. Okay.
All right, so let's go for those numbers and the description of how to find your place. Remember that all of this is starting tomorrow. Your best bet is to be an early bird. All right, so.
Okay, so the open day is tomorrow, March 26th. It starts from 11:30 a.m. It's at number 58 Yakubu Avenue, Angwarimi, GRA. It's on the road of Bafra Hotel or the UNICEF office. And the numbers to call for inquiries are 080-9033-2958. That's 080-9033-2958. A second number is 090-8741-5612. That's 090-8741-5612.
I'll have you call out those numbers quickly once again before we go, because people need to have those numbers. We need these services. All right, so call those numbers out again, please.
So that's 080-9033-2958, 080-9033-2958, and 090-8741-5612. 090-8741-5612. We're also on Facebook, so it's NISA Reproductive Health Center, Kaduna.
Okay.
So you should get a bit of information from Facebook.
Okay.
Yes.
Okay. NISA
Reproductive
NISA.
NISA. So NISA Reproductive Health Center.
Okay.
Kaduna. Because remember, the main hospital, our headquarters is in Abuja. So they also have programs going on. But make sure it's the Kaduna NISA Reproductive Health Center page you're looking at.
Okay. Well, before we go, I just need to quickly add. The stories I've heard from Dr. Selma talking about, things, procedures that have happened to women that, just change the direction of their reproductive life is something that we need to be very careful about. Ladies, I'm talking to all of us, particularly those of you who are still young, those who are still, in the markets, not like us who have hung our boots, but you need to be very, very selective, very, very careful about where you go to access services as regards your sexual or reproductive health. I tell you, a lot of things going on. In Nigeria, we don't know how to sue for malpractice, but you need to get professionals. You need to get people who know what they're doing. A word of advice, anything you want to tell us before you have to go today, Dr.
So
Selma?
what I'll just say is as regards surgical intervention. So if you've seen a doctor, particularly in a private hospital, and the person wants to do surgery, whether you're a man or a woman, few questions to ask. Remember, as a patient, you have rights. So you have the right to ask the doctor, are you a gynecologist? Are you an obstetrician? For the men, are you a urologist? Then also find out, do you work in a teaching hospital? And the reason why I use the teaching hospital is that you are sure of the quality of staff that work there, because some doctors in the teaching hospital also have their private hospitals. So, those are safe places to go to. So if you have a doctor that also works in the teaching hospital, then that's fine. You can access that doctor in the private hospital. It's your choice. But ask questions. I've had so many people come in. You see a cut on a woman's abdomen. I say, what surgery do you have? I don't know. What procedure was done? I'm not sure. Ask questions. It is your body. You brought yourself to the hospital. Oh, doctor, you say there's going to be an operation. What do you want to do? Or you say there's fibroid. Explain fibroid. Make sure you understand before you subject yourself to the knife. And same also for the men. So that's just my advice.
Indeed. When you hear that there are many young women who have been rendered or sent into early menopause simply because a doctor decided that he wanted to make money from an unnecessary surgery, you understand where Dr. Selma Pam is coming from, and personally where I am coming from this evening. I've heard so much I don't know about you. Thank you so much for being here, Dr. Selma Pam. Like I said, we'll continue to disturb you to make sure that you come in, because every time you talk to us, something new is learned, and we appreciate you for that. Thank you so much.
You're welcome. It's always a pleasure here. And thank you, listeners. Thank you for your questions. Hope to see you all tomorrow.
Tomorrow is when it starts. We have 2 months, but tomorrow, like they say, grab it while you still can, because you never know. They might reach halfway now and change their minds that it's not going for another 2 months. So your best bet is to be an early bird. Be there tomorrow. Like I said, very close to the Essence International School. Okay, so let's just say straight down from the NEPA roundabout, where we call NEPA roundabout. Just keep going straight down to the end of the newly created dual carriageway. That's Wharf Road. Just keep going down, and then you will see UNICEF, and then just branch. If you take Wharf Road, it will be to your left. Yeah, that's right. Cannot take any more questions. We love to bring you these freebies. It's a unique package that is not a daily thing, and that's why we know that we had to bring this to you. Prices have been slashed to almost nothing. Access those services. Go and ask questions. Have your questions answered. Like Dr. Selma said, at least now you know. You're not in the dark anymore. You know, and then you can make an informed decision about your next step. I hoped that Dr. Selma will be seeing a lot of you who will say, I heard you yesterday. I heard you yesterday. All right. Until next week, Friday, when we hope to come your way again, take your health very, very seriously. Do not just put yourself in anybody's hands and be coward into thinking, oh, he knows best for me. It's your body. Yes, he might know best, but like Dr. Selma said, ask questions, please. Ask questions. Have a victorious weekend ahead.